Hello, my name is Gail Lowe. I'm going to be your tutor on the Aromatherapy Diploma. I've had 28 years of a marvellous career doing aromatherapy and massage and working with all different types of patients and clients. And I really would like to share with you on this course some of my knowledge, some of my experiences and blends and what I found successful and not so successful, so that you can really start your aromatherapy with the best advice and knowledge I can possibly give you. So let's press on and teach you some of the basics of the aromatherapy. So let's start. The holistic approach is the term that we give to treating the body as a whole. This is a Greek term which means holos, and it means the whole body. So we're talking with aromatherapy of treating the mind, the body, and the spirit, and using essential oils so that we can treat physical, mental, and emotional conditions. And in order to do that, we do need to make sure that we get a good, thorough knowledge of the client's background, what they do socially, what their familial situation is, do they have children, are they married, are they working, what type of job do they have, what are the demands of their job. Personally, how are they feeling? How are they coping now after lockdown? How did they cope during lockdown? The more detail and thorough background we have for our clients, the better oil choices we're going to make and the better success our treatments are going to be for them. So, holistic approach is treating the whole, the mind, body, and the spirit. So while we're gathering information about our client's background, we're also going to be thinking about the way their environment is affecting them. We have a lot of negative and positive factors within our lives that affect us. Computers and mobile phones, if we use them too much, have a negative factor in the lack of communication face to face with people. Too much processed foods, which contains a lot of chemicals, can affect the way we feel and affect our digestive system long term. Lack of sleep, lack of exercise can make us very stiff. I've been really busy massaging people who sat so long during COVID that their lower back and the muscles of their legs have shortened, and when they come to stand up, they're in a lot of pain. So this all has an effect on how we feel physically and emotionally. Stress, fresh air, pollution, jet lag. Well, nobody's really going very far now after COVID. But however, this all affects the way we feel. Financial difficulties often give people lower back pain. Lack of natural daylight affects your feeling of sad. So seasonal affective disorder is something some of us might be suffering from. And homeostasis is a term which is about the physiological balance and equilibrium of the body despite external influences. So in our treatments, with physically massaging somebody with the aromatherapy oils, the essential oils we've blended, we want to try and bring back the homeostasis of their body. The aromatherapy treatment is predominantly an effleurage massage. We very rarely would use too much tapotement or percussion within our treatment. But we do use a combination of effleurage, petrissage, passive movements, tapotement, maybe a bit of acupressure as we sort of walk around the face, finger walk. Effleurage is a sort of stroking move that we use with the flat of the hands. Pressure goes towards the heart. We mold around the contours of the body and come lightly back. Petrissage is a more ringing, kneading, rubbing, rolling, frictioning type movement, which gets a bit deeper than the effleurage and picks up the skin and the muscles underneath. Passive movements are where we might support the body and move it passively, so it doesn't involve the client actually acting outer move. So we pick up the body, we might rotate the ankle, rotate the wrist. That is a passive movement. Tapotment is a form of light percussion. It's a sort of tapping on the face. So if you tap your fingers on the face to stimulate the nerve endings, that is tapotment. Acupressure is where we might finger walk around the face, pressure points on the face. That's how we use acupressure.
The massage movements that we're going to be using in aromatherapy are a combination of the classic movements for any massage technique. Aromatherapy is much more effleurage based than any other massage, because the whole onus of our massage is to get the oil through the skin as quickly as possible, as well as relaxing the client, helping the circulation and the lymph drainage. So effleurage is one of the main movements that we use, and this is also a sort of stroking move that we do with the flat of the hand, stroking and applying pressure up to the heart and moulding our hands to the contours of the body. So your hands are flat, your fingers and thumbs are tucked in, and effleurage is a sort of stroking movement. Petrissage is another movement we use, and this is where we wring the body. This is an umbrella term for all the movements that pick up and squeeze the flesh. They might be kneading, rubbing, rolling. Frictions is included in this heading as well. Then passive moves are anywhere where we support the body and rotate the joint of the body. So this might be the ankle or the wrist, or we might turn the head from side to side, and that is a passive movement. Then we have maybe a form of percussion, which is called tapotment, which you might do with your fingertips. And we have some forms of acupressure, where we apply pressure around the face, around the eyes, to release tension. So there's a combination of movements that our technique is going to involve when we come to doing our practical. I'm going to go through those in a little bit more in depth in a minute.
So having predominantly used effleurage to relax and give our clients a sense of well-being, we're going to go a bit deeper and we'll manipulate the tissues. And we manipulate them by rubbing, pulling, doing frictions, kneading, pressures, wringing, maybe knuckling in some places, anywhere that we use compression. The rule of thumb generally is we knead where it's needed, and this releases muscle stiffness and tension. And frictions are a natural analgesic, which means that they're a pain reliever and they stimulate the body's natural endorphins. Psychologically, it's both relaxing and invigorating. It increases the blood supply, breaks down and aids toxin elimination, breaks down fatty deposits, relieves muscle spasms, prevents stiffness after exercise, and also breaks down adhesions. So it's a good move to use after somebody's had an operation, when the site has healed really well, and we can often use Petrissage to break down adhesions. We need to include passive movements in our treatment, and a passive move is anywhere where you pick up the body and you put a joint through its range of movements without the assistance of the client. So we're encouraging them to relax while we maybe rotate the ankles of the feet, maybe rotate the wrist of the hand. We might lift the elbow in a figure of 8. We might rotate the shoulder. Anywhere where we feel there's a bit of stiffness and we want the client to relax and just let go of their body so that we can move it for them. That's a passive move.